How widespread is it? Because I'm looking at the medical scape in the country where a lot of people do not go for diagnosis. You know, you just decide today, let me just go and find out how my kidney, how my liver, how my heart is. It's only when I hear a sharp pain somewhere or I have some symptoms, that is when I go. And I believe that is why we have so many cancer cases, because they are diagnosed when it's too late. How widespread is it in Kenya? And diagnosis themselves, diagnostics of any heart condition in the country.
All right. So the good news is that heart failure as a condition itself is actually a disease. So it's a condition, it's a syndrome that is where you arrive from many diseases. So there are many diseases that can cause heart failure at the end. Now, heart failure itself can be diagnosed easily just by talking to the patient. But to be able to categorize the patient and say this heart failure is coming from this condition, I should be treated this way, that may require some special attention, and that's where the heart doctors come in. So with a simple ultrasound called an echocardiogram, you can be able to tell which kind of heart failure you're dealing with and treat it. We have a device called an ECG that studies the heart rhythm, and from that we can tell roughly what's causing your heart problem. Because some people get heart failure from very fast heart rhythms, for example, or from very slow heart rhythms, and those can be treated. I said before that heart failure is a serious condition in most cases, but there are actually some cases where you can actually completely reverse the heart failure. So you can treat it and actually cure it in some cases. Though majority of patients that have got heart failure have got a problem with the heart muscle from different conditions, and those may not necessarily be cured, but they can be treated very effectively and they can live long. But they are both seeking healthcare and just trying to find out what do I have. My colleague Josephine said correctly that hypertension is the most common cause. The majority of patients that we see in Kenya with heart failure actually have got untreated hypertension. And to diagnose hypertension, you just need to put a device on your arm, dial it, and get a reading. Once you get that reading, interpreting is actually not very difficult because there are many devices that can tell you what the readings are. But it's just the exercise of just checking your blood pressure, and once you're diagnosed with hypertension, treating it, that will eliminate quite a number of people that we see with heart failure. Because even in our country, untreated hypertension is actually the most common cause of heart failure. The other causes where the valve has a problem in children, for example, is a common problem. And those two, just with an ultrasound, we can tell that your valve has a problem and it is severe enough to require treatment. Many of those people that have got severe valve disease will require surgery, and even that is available right here in Kenya. In fact, Karen is one of the centers that offer the valve transplants and all that. So to diagnose it, you have to talk to a clinician. They don't have to be very specialized in their field. They'll know because it's a syndrome. Based on a list, they tell, oh, this patient most likely has got heart failure. Now from there, you may need specialized tools to be able to tell which kind of heart failure is it, about treatment that you really need.